finished refracting, just making sure I fine tune it for you. Can you read that, please?
E.
Come on, I know it's difficult.
Z. C.
A little
E.
blurry?
Yes.
Yes, tell me to stop.
Stop.
Okay. So we just fine tuned and thank you, Ken. Finished. So for doctors who are watching today, we have radial keratotomy complications from all over the world who've landed, but I want you to not give up on them. Here is, Ken, quickly, 20, if you can in 10 seconds give you a story, just 10 seconds, Ken, and I can review with the doctors.
Yes. I'm from Port Richie, and I've had RK surgery back in the late 80s. I've got 16 cuts per eye, and it's at first it wasn't too bad, but as time goes on, it's gradually got worse. In the last few years, it's particularly my right eye, it's gotten very bad. I have great fluctuations from the morning to the afternoon, and most of the doctors, well, all of the doctors that I've gone to do not like to attempt to go in and try to correct this procedure, especially since I have glaucoma, and I've had several glaucoma surgeries in addition to the RK.
Great. So for doctors who are watching today, radial keratotomy complications from all over the world have landed for us to fix. Many of them have 4 cuts to 16 to 21 to 30 cuts, astigmatisms from 4 diopters to 24 diopters, and a lot of other comorbidities. And again, many of them can due to stories from every surgeon is nothing can be done. There is no such thing. In fact, Ken has multiple surgeries. He's had 9 surgeries beside RK. You can see his RK cuts here, pseudophakia with multiple lens exchanges done. You can see the glaucoma shunt tube here in the anterior chamber, trabeculectomy, blebs, a lot of stuff going on. And of course, the astigmatisms over 10 diopters, unreadable in most of the cases. Keratometry extremely high from RK ectasia and pseudophakia. So I just measure them. Again, as you know me, you must refract them, even though patients are landing all day today. It's me intense with each patient and overriding millions of dollars worth of technology that they've been through at my institute for diagnostics. And I have found this vision to come to about 2060 with my refraction, despite all this stuff going on. And that perception you gave me was how much, Ken? On 10?
Oh, it was 7.
Lovely. So that 7 on 10 perception is good enough that I feel I should fight, despite his very bad glaucoma and surgeries too, despite the RK. So I'm ready for you, Ken. And as you'll have seen this image of his eye, tremendous astigmatisms, corneal scars, shunt, everything going on, blebs all around. But that's fine. We'll do LaZrplastique tomorrow surgery for him. All set?
I'm ready.
Love it. Excellent.
I've had RK, I've had multiple glaucoma surgeries. My vision is in my right eye. I'm legally blind. The previous doctors I've gone to say that there's nothing that they can do, or nothing that they want to attempt to do because of all the surgeries that I've had.
What I'm doing is, I don't care how many surgeries he's had and how bad his eye looks. I will show you how his eye looks with all the surgeries, cuts and shunts, everything inside. But there we are. Excellent. Wonderful. Super. 3, 2, 1. So Ken, we just finished doing LaZrplastique on your eye. Can you tell any difference?
Yes, the orange flashing light is clearer.
Fantastic.
The rim, the white rim light around it is more distinct.
Super. Any pain at all?
No pain whatsoever.
Super, Ken. For doctors who are watching, if you can see now the entire reflex is a perfect circle, which I call the circle of sight. And that translates to vision, correct, Ken?
Yes.
Super. And for doctors again, when we started the case, I showed you the anatomy. You can see the complete bleb here of his glaucoma shunt. You can see the tube of the shunt in the eye. You can see all of his RK cuts here, over 20 cut RK, a lot of irregular astigmatism and scarring, multiple cataract surgery, multiple iridectomy, and compromised vision even at macula, but the patient immediately noticed the difference and the reflex is a perfect circle. I'm very proud of you. Safe travels back. I'll see you tomorrow.
Okay.
Congratulations.
Thank you very much.
Morning, Ken. How are you?
Good. Doing very well. Thank you.
Get some sleep?
Oh, I
Yes.
got plenty of sleep.
Super. I heard all our patients were in different hotels in town, all over. But any pain at all?
No pain.
And I also do this impromptu for doctors as I keep teaching and encourage them. This is again superficial laser techniques, no pain at all, even on asking, even on such detailed and extensive cases. As I showed you his history yesterday, 20 cut RK, multiple surgeries, trabeculectomies, shunt. You can see the tube in the anterior chamber right here. And you can see multiple cataracts with lens exchange techniques, corneal techniques, completely failed with very poor vision. And also has maculopathy. That with that level, nothing can be done. There is no such thing. You saw me refract him. We did surgery yesterday right under the laser. Can't you can see the difference right there?
Yes. And
I'm ready for him to travel back all the way. So can be a real pleasure. Anything you want to add or say for doctors?
No, I just would like to thank you very much. You've given me a lot of hope, and I'll know in the next 5 to 7 days as my vision gradually improves and gets back to where I can function like a human being again.
Yes.
Thank you again.
You're not only human, you're an amazing human being. That's why I say I don't like these things about patients being told nothing can be done. And here you are, another example. And I even have names for these things which I teach surgeons with in a provocative way. That these are what I call cocktail surgeries, multiple, and no direction. But again, very, very pleased with you, Ben. Safe travels home and take care of that eye for me.
Thank you.
Wonderful.